Hello, I'm Susan Cole from NAM aidsmap, and I'm thrilled to be here with Siobhán Lanigan from the food chain to talk about the UK AIDS Memorial Quilt display, the largest display in the UK since what year?
Since 1994, when the panels were all out together in Hyde Park in London. There have been smaller displays in other parts of the country, but this is the first time in all those years that we've been able to bring it all together in one place.
Wonderful. Why is the AIDS Memorial Quilt so significant?
The AIDS Memorial Quilt in the UK is part of a global response to HIV and AIDS that was taking place back in the 1980s and 1990s. It started in the United States with the idea of memorialising somebody in one panel and then joining all those panels together in larger ones and then joining all of those up. And that has taken place across the world. It was known as the Names Project, and there have been Names Projects in many different countries across the world over the years. And the one that we have here today is the UK AIDS Memorial Quilt panel. And there are 48 of these very large panels, plus some individual panels that were made and didn't get contributed at the end of the project. And each and every one of the panels here represents a life that was lost to a virus. But it was a virus that was surrounded in fear, stigma, sometimes hatred of the people who were living with the virus and who were dying as a result of it. It's so important that those lives are kept in our minds and consciousnesses and sometimes reclaimed from the stigma, because they're just the lives of lovely, ordinary people, and these are full of celebration and life, a living memorial to the people that we lost in the early days of the pandemic.
So many of the AIDS dramas that we see focus on gay men, so it's wonderful to see so many women are included in this display. Tell me about Louise.
As you can see, Louise was just 24 when she died. And what her sisters say about her is written in the letter that they sent into the Names Project. And what they say is that she was the most lovable, vibrant person I've ever known. She always wanted to make us feel special. We will always love and remember her. And I feel quite honoured, really, that 40 years on, more or less, we can also love and honour Louise, because she is still here and in our memories, brought alive by the panel.
That's so wonderful. Although most of the panels in the quilt display do name the person lost to AIDS, a number don't and focus more on the communities that have been affected. I asked Siobhán about a beautiful panel that simply said Mum.
So the person who made this dedicated it to all women lost to AIDS. It also honours a friend's mother who died in 1985. When her health went into terminal decline, she chose to face her imminent death squarely and to claim it as her own, while she still could. So she called on her son. With his support, she took her own life. Shortly afterwards, her son discovered that he too was HIV positive, and at the time he was just 17. He can never forget, which to me means that possibly and hopefully is still living today. There are several years between the panel being made and this being written, so I take from this that hopefully the son is very much still with us.
Despite the huge advances in HIV treatment and prevention, today over 300 children and adolescents die each day from AIDS-related causes. However, since the start of the pandemic, millions of children have died. Siobhán discussed the panels dedicated to children.
Babies and children were also affected by HIV and AIDS in those early years, and indeed that they still are now around the world. So there are various places in the panels, including this one, where there are some really lovely reminders of that.
I also spoke with Clifford McManus from the food chain, who's been working on putting together this incredible display. We discussed some of the panels dedicated to people who worked in the arts and celebrities who've created quilts. Starlight Express, that's incredible. And you've also got celebrities who've made some of these quilts.
There's also a quilt that's just signed Love Vivian, and we believe that's Vivian Westwood. And the signature does look like Vivian Westwood's signature. And there's also an article about fashion designers making quilts. When I looked at the paperwork behind it, it's Marc Jacobs from New York. There's actually a letter from him.
Clifford also shared what he knows about some of the panels created by people who have lost loved ones to AIDS. So tell me about the panel dedicated to Andrew.
So this panel was made by a guy for his one and only love, Andrew. And we have letters here to describe how their relationship was. He introduced Andrew to lots of music, so there's a cassette tape there. And they would walk in the moonlight, they would write poetry to each other, and it just sounds like a really, really beautiful relationship. So the quote on the panel says, don't be dismayed by goodbyes, is adapted from one of Andrew's favourite books, Illusions by Richard Bach. Every time I've become sad and heavy-hearted about his impending death, he'd hold me in his arms and say, do you love me? And my answer was always and still is, yes, yes, yes. Then we will meet again.
HIV-related stigma blighted the lives of so many lost to AIDS. One panel in particular starkly demonstrates this stigma.
The family of this person don't want the quilt shown anywhere in public. They don't want their son to be associated with HIV or AIDS. But because the panel was already sewn in, they came to an agreement that they would just cover up the panel, and the panel just reads, this panel was made by a friend for a friend. The parents don't want this panel shown anywhere. The stigma still exists. Until this changes, the panel will remain covered. A red ribbon is not enough. A quilt is not enough. What will it take? Attitudes must change.
One of the quilt makers, Dr Gill Brigg, spoke to me about a panel she helped make for a dear friend, Vaughan Michael Williams. It's so wonderful to have an actual quilt maker with us today. Thank you so much. Tell me about Vaughan.
Well, I met Vaughan in 1970. We went to high school together, and it was obvious from the first day we met that we were actually going to get on, because we were slightly a bit off the wall compared to all the other kids. We liked drama, we liked theatre, we liked singing, and we did lots of shows outside school, so we were pretty close friends.
Tell me about this incredible quilt. How did you make it?
Well, when we first decided we were going to make a quilt panel, it was very early on, and we were still very deeply into our early grief. Didn't quite know how to organise our hands, our hearts, our heads. It was very traumatic, as you can imagine. So we decided we'd do different sections. We knew what we wanted to put on the quilt: the teapot and the border and the jumper and the plant. And his name, of course. And then we went away, worked on them individually, and then when things weren't quite so raw, we came together and compiled it in Paul Burston's flat in London.
Wonderful. And why is it so important to see it, and how does it make you feel?
Well, it is partly the emotions that come up when I'm looking at his panel is because of the context of all the other ones. So I obviously have my own relationship with Vaughan and his death and his awful last few months, but then you magnify that by all the other panels that are here, and that's very sobering and takes me back a long way. But then I love seeing it because it gives him back his name, and is a name he chose not to use for the last few months of his life because he felt so stigmatised. And I'm really glad to see his full name up there. It gives him his name back.
That's so wonderful. Thank you.
My pleasure.
We've lost so many important activists to AIDS over the years. Scott was a trustee of Milestone House. Tell me about Scott.
So Scott was a nurse by background, and he was on the board of trustees for Milestone House, which is in Edinburgh. He was a trustee of Waverley Care, which still exists today as Scotland's HIV support charity, and one of the partners in the Quilt Partnership. And he was highly influential in what Milestone House was, the construction, the design, the nursing policies, and the management of what was the first and only HIV hospice in Scotland. And of course, so importantly, there's nobody better equipped then or now to talk about the needs of people living with HIV than people living with HIV. Nobody else can say it better or have a greater level of understanding. It's the HIV positive community of people that make the difference, and will continue to do so until we don't have to have any services, because everything's sorted out when that day comes.
Absolutely.
I hope we're both still around when that day comes, Susan.
Absolutely, that is so important, Siobhán.
And so with people like Scott, we can see how much real impact they had in their lifetimes, in their short lifetimes. Within the Quilt panels, there are at least 4 different panels in memory of Scott, which just shows how much he was loved and respected, and how much people wanted to demonstrate how much they appreciated everything he'd done.
Wonderful. Finally, Siobhán spoke to me about why it's so important to remember those that we've lost.
I think for those of us in the UK, we're looking back at a 40-year history of HIV, and we've seen some tremendous advancements in the treatment and care, and indeed the support of people living with HIV and the prevention. So we now live in a time when, if somebody is diagnosed early and able to access treatment and be on treatment successfully, somebody can live a long and healthy life with HIV, and indeed they can reach a place where the virus is undetectable for them, which means it's not possible to pass it on to anyone else. These are magnificent, tremendous developments, even though we don't yet have a cure for HIV. But for the people we're remembering here, that wasn't the experience, of course. In those early days, an HIV diagnosis was an almost inevitable death sentence, and so many lives were lost in such a hostile environment and surrounded in such stigma, that it's seriously important that we don't forget that. Those of us who are still here, who are still working to end HIV and to end AIDS globally, it's so important that we don't forget the people that we lost in those early years. Otherwise, that will all come back again. If we lose track of where we've come from, we won't be able to get to where we need to be, which is an end to HIV and AIDS globally.